اتكلمنا في الماضي كذا مرة على زراعة الأعضاء لأنها الحقيقة أزمة عالمية، بالذات لما بنتكلم على الكلى. نسبة الفشل الكلوي في العالم كبيرة جدا، في أكتر من 2 مليون شخص في العالم عايشين على الغسيل الكلوي، وطبعا بيكون الحل المثالي ليهم هو زراعة الكلى. ولكن مشكلتنا دايما هو أن احنا نلاقي متبرع بالأعضاء. مشكلة التبرع كبيرة جدا في العالم العربي كمان، والنهاردة عايزين نركز عليها بالذات. وأنا النهاردة في مدينة الشيخ خليفة الطبية في أبو ظبي، ومعايا الدكتور محمد بدر زمان. Hello, Dr. Muhammad. Very nice to have you on the show.
Thank you very much.
Today we want to talk about the kidney transplant, but we don't want to focus on the patient, we want to focus on the donor, because donors are really, it's a worldwide challenge to find a donor for a kidney. So first let's start by talking about the numbers in Abu Dhabi of patients who need a kidney transplant or are waiting in dialysis.
It is a global problem, as you just mentioned. Unfortunately, today, only in Abu Dhabi, we have around 2,000 patients who are on dialysis treatment.
That's only in Abu Dhabi.
Only
That's
in Abu Dhabi.
And population, yeah.
And unfortunately, every year we expect to see around up to 200 more patients who advance to dialysis. So it's quite a dire situation.
And how many donors do you have to balance that out?
We clearly cannot meet the challenge of in terms of the numbers of donations. And it's a worldwide problem. Over here as well, we are struggling in this area. Numbers of transplants are much less than the number of people needing it.
And on what basis do you choose the donor? What are the criteria that make you choose the donor?
You know, for live donations, the criteria are that person has to be 21 or older. Any age, we assess the donors. They can be into 60s, but we prefer younger donors. They have to be relatives. They have to be in good mental and physical health. And they should have a very good social support system. And all of this is looked at, and then the donor is discussed in a transplant selection committee. And once every member of that committee, which include a surgeon, a physician, a psychologist, and the doctors from other areas, once everyone approves them, then only this donor can proceed for donation.
Let's follow a story of a young boy, Owyes. He was only 17. When out of the blues, he just discovered that he has a kidney failure for no reason. And let's see what happened with him and who came forward to help him from his family.
كان عمري 17 سنة، كنت عم أقدم الثانوية العامة، كنت رايح الدكتور كمراجعة عادية، ففجأة إنه اكتشفت بعد ما عملنا تحاليل إنه أنا معي الفشل الكلوي.
أول ما عرفت بالخبر مفاجأة كتير كبيرة، أنا كنت برات البلد، زوجتي خبرتني، حسيت إنه أنا لازم فوراً أعمل شيء.
أول ما درينا بالفشل الكلوي دورنا على حل الزراعة. بعد التحاليل والماتشنج طلع إنه الوالد هو أحسن شيء للتبرع.
كنت جاهز فوراً، أقول إنه أنا جاهز لأنه أعطي ابني الكلية فوراً، ما كان عندي أي لحظة تردد بهذا الموضوع. والماتشنج هو المهم، اليوم أي شخص غيري حيكون الماتشنج نسبته أقل. لا، ما بدي فوت بهذا المخاطرة، لا، وابني أحق مين يساعده هو أنا أبوه.
So Owyes' father was his perfect match.
You know, of course, relationship, when you're a family member, your chance of being a good genetic match is very high. Owyes was very fortunate that he had a very good match with his father.
So what does the donor, now that you've selected him, you found he's a perfect match, what does the donor go through in terms of surgery?
The donors are very fortunate now that we offer them laparoscopic operations. These are the operations where we use cameras and very small incisions. So as opposed to very large incisions of the past, now we can do the same surgeries.
We have a torso here.
Yes, you do.
So in the past you did, how big was the operation?
So this is the size of a kidney.
Okay, yeah.
And kidney essentially is like a filter. The blood goes in through the red pipe, comes out through the blue pipe, and basically filters, and the urine comes out here, which goes into your bladder, which you get rid of. It's a very small but very complex organ. So we usually like to take the left kidney because the way the vessels are, and we do this operation laparoscopically, as I said. At the end, of course, this kidney cannot come out from very small incisions.
That's what I wanted to ask you.
So a very small incision is made just to allow our hands to go in. To take out the kidney.
Ooh,
is made in the very lower part of the abdomen, where it remains hidden in your undergarment. So essentially you don't see any scars in the long term.
Okay.
If this is the lower part of their tummy, this is the leg, so we just put this kidney in their pelvis, where we join the blood vessels and later join this pipe for urine with their bladder, from where it will go.
Perfect. So the donor goes through this laparoscopic and small incision, and you take away one kidney, so he's left with one kidney. And how long does the operation take him? How long is his recovery period after that?
Operation takes around 3 hours for the donor and 3 hours for the recipient. These are overlapping operations, so the total operating time is around 5 hours.
So you do them at the same time?
At the same time, essentially overlapping. We start donor first, then the recipient comes in. We do not take the kidney out up until we are absolutely sure that the recipient can actually take the kidney.
It's a complicated process. It's not easy. And how long does he recover, the donor? We're talking
Donors,
obviously.
because of the laparoscopic surgery, they recover very fast.
Okay.
Usually, their normal stay in my hospital is 3 days.
Okay.
And many of them, I can assure you, can go home within 2 days, because laparoscopic surgery is associated with less pain, less hospital stay, and better long-term outcomes.
Less bleeding and everything, of course. Now this person is living with one kidney. What are the measurements he needs to follow up on throughout his life? Does he need lifestyle changes? Does he need to do regular checkups for life, or what?
Before I say that, I just want to say one thing, that donation is the most noble thing a person can do, whether alive or afterwards somebody makes the decision. The other thing is that these people are advised in the long term to have regular follow-up with the doctor. That means at least once a year, get their kidney functions checked. We tell them that, look, keep a good lifestyle. They need to control their weight just like any person has to, and they need to drink plenty of water.
Okay.
And if donors follow this regime, I have seen excellent outcomes in the long term.
That's all they need?
That's all they need.
Can they be smokers?
Their medicine,
well,
smoking is another thing that I will not take a kidney from a smoker.
Okay, so let's finish up with a few advices you give people in general who are able to donate their organs.
There are millions of patients today who need organ transplantation. They are living with organ failure. And clearly their outcomes are going to be inferior in the long term. I urge people to consider, donation after death, to have, and also, those families who have family members with organ failure, to start thinking about if they can help them.
I think in all cultures, when we love someone, we tell him always, we'll give you our eye. We say it in Arabic, هديك عينيا, I'll give you my eye, for example. So it's always, and I think it exists in all cultures as an expression of, I'll give you something very
I think
dear.
They need to say, I love you with my kidney.
Yeah, exactly.
Yes.
So I thank you very much for this interview. And let's end with the story of Owyes and see how he's doing now.
هلا عايش حياة طبيعية وأحسن من الأول، حتى صحتي صارت أحسن، في نشاط، في حيوية أكثر.
أنا باكل الحمد لله شو ما بدي، بشرب شو ما بدي، بروح وين ما بدي، بعمل حياتي طبيعية 100%، ما عدا طبعاً الرياضات العنيفة.
لبي قبل ما يقدم لي الكلية كان له فضل علي، فهلا كيف إذا قدم لي كلية ويعني صار الفضل ضعف؟
العطاء أجمل شيء بالحياة، فمن أحيا نفسا كأنما أحيا الناس جميعا. اليوم العطاء أجمل شيء بالحياة، وهو بيعطي قيمة للحياة.